Hello, everyone. My name is Sara Jerving. I'm a health reporter with Devex. So, the climate crisis is a health emergency, but not everyone understands that. Health is not formally on the agenda here at COP27, even though the implications are huge in areas like cholera, malaria, dengue, mental health, the list goes on. Today we're going to have a wonderful set of speakers to discuss the urgency around health in the climate space. If I could welcome Alice Bell, who is Head of Policy for Climate and Health at the Wellcome Trust, Lashley, who is the UNICEF Youth Advocate for Barbados and Executive Director of the Lashley Foundation, Diana Picon Manyari, who is the International Climate Director for Healthcare Without Harm, and Dr. Diarmid Campbell-Lendrum, who is Head of the Climate Change and Health Unit at the World Health Organization. Thank you all so much for joining in this important discussion. Dr. Diarmid, can you start us off and talk about kind of what is the intersection of health and climate, and what illnesses are you kind of particularly concerned of, or anything kind of related to the health sector and climate?
Fantastic. Thanks very much first for this really interesting panel, and also the rest of the discussion. I was listening to the rest of the discussion on agriculture and so on. I think you summed it up already. The climate crisis is a health crisis. And it's interesting, when we're exchanging about what we should cover in this, I was wanting to jump straight to the solutions, because for us at WHO, it is so obvious that the climate crisis is a health crisis that we actually want to spend a bit less time talking about that and a bit more time talking about what we do about it. And I have to remind myself that not everybody gets that. Not everybody understands those links, or is not aware of those links, or is tuned into what we need to do about it. And we sometimes talk about it as a health crisis or as a health emergency. And the evidence on this is absolutely rock solid. We have a couple of decades of evidence on it. I was one of the authors of the health chapter of the latest IPCC report, the AR6. And my summary of the AR6 is, we told you this a couple of reports ago, and it is the fact that we know that weather and climate are directly related to heat stress, and that heat stress kills a lot of people. And we even have direct experience of that. And and this is across the spectrum, from richer countries to poorer countries. So I live in France. I'm French as well as British. The big wake-up call for us was the 2003 heat wave. And that killed, by the time we'd done the sums, that killed 70,000 people in Europe. It's very hard to kill 70,000 Europeans in one go. That event did it. And that is one of the richest parts of the world, the best health systems in the world. So we have good evidence on the direct effects, and we know that climate change is making that worse. And we're seeing more, we're seeing heat records set around the world, and everybody in this room knows that. So that's direct effects. We also have the indirect effects as well. So again, we've known for a couple of decades that diseases transmitted by vectors or transmitted through water, so malaria, dengue, diarrheal disease, cholera, and so on, some of our biggest infectious disease threats are very, very strongly influenced by weather conditions. And we've been producing projections for some time showing that the warming world, a more variable world, makes it easier to transmit those diseases. And we're also seeing it in real life as well. So everybody will know what has been going on in Pakistan in the last little while. The devastating floods in Pakistan, directly taking lives, directly destroying health facilities as well. So we're not only taking lives, we're destroying the infrastructure, the capacity to protect people. So I understand it's about 1,500 health facilities which have disappeared. And at the same time, those floods will increase the risk of infectious disease, water vectors, and so on. So we have evidence on that as well, and direct experience. And then the third big category that we have is the more indirect effects, and it relates very closely to what we're just hearing from the previous panel. So from a health point of view, We see what is going on in the Sahel or what is going on in the Horn of Africa, the impacts on food security. What that means for us and for WFP and others is 33 million people at risk of hunger, 11 million children at risk of acute malnutrition, and having to do all of the work to try and protect those people. And also the even more indirect effects of having people have to move or the possibility of increased tensions and conflict over resources. That is a crisis across the board, but it's also a health crisis. So I'd just like to, hopefully that's clear enough. That one more issue I just like to mention as well, so we can talk about it as an emergency. It's also, in our terms, it's also a chronic disease. So it's not only the impacts of climate change, it's the health impacts of the causes of climate change. So we lose about 7 million lives a year from air pollution. So that's a death about every 5 seconds. That is as big as any health risk factor that we have. And for outdoor air pollution, which is about half the problem, 2/3 of that exposure, 2/3 of those deaths are from burning of fossil fuels. So we have, and that impacts on heart disease, it impacts on cancer and many of the non-communicable diseases as well as the infectious disease. So for us, it's never questioned now that the climate crisis is a health crisis, and that's why we want to jump as quickly as possible to talk about what we're going to do about it.
And Alice, you work for a research funder. Can you talk a bit about how health research needs to change moving forward to adapt to the changing climate?
Yeah, well, at the Wellcome Trust, our climate and health program is relatively new for us, and it comes out of a review of how we fund science and health research. And so we're trying to embed a lot of our thinking in terms of what needs to change in health research and generally. And at the climate crisis, I think really it's forcing us to change. So there's all sorts of people in health research like, we need to do this, we need to do that, and they're not getting around to it. The climate and health research team that I work with are like, we need to do this now. This is an emergency. You can't just sit in a meeting about how you want to change how you're going to do research. So they are on it. And there are various different things they need to do. I think, first of all, we need to think about who we're funding. So institutions like Wellcome have funded health research for years, and they make lots of grand statements about who they're going to fund, but quite often they fund their friends at Oxford and Cambridge. And, we might even think about funding some Americans, but, or, some of the other European partners, but they're the kind of the Ivy League names. And that is continuing to send very important resources, like incredibly important resources, to places that already have resources. And when we think about how the climate crisis is inherently so much a problem of global inequality, we need to think about how we're putting those resources to study the climate. The health impacts of the climate change need to be studied not just in Oxford or Cambridge or Paris or Boston. They need to be researched in the places that are feeling climate change the worst. Communities who are having to be at the front lines of climate impacts need to have ownership and be able to direct. They understand what research questions we need to be asking. They also need to have ownership of that research so they can use it. So Didi in that previous panel was just talking about the gaps in nutrition data and how we need to have that regular, fast, and it's people who are at the front lines of the climate crisis who need to be defining the questions and using those answers. And so foremost, we need to be thinking about how we put research resources in the hands of people who are going to use it and who are most affected. We also need to think about how we share it, how we link it up with it. There's all sorts of things about how can we get health researchers talking to climate researchers. We're talking about the problem of trying to define the climate crisis as a health crisis. One of the problems in that is that the climate crisis conversation has been dominated, understandably, by atmospheric physics. Like counting carbon is important, counting methane, all the other greenhouse gases. It's essential to understanding the crisis, but it's only part of it. And the climate research as a field has come from so many different disciplines. It's so incredible. I find it really inspiring the way in which humans have. They've caused the climate crisis, but then they've discovered it and they've learned about it. We are clever enough to have discovered this problem, even if we're not clever enough to really tackle it. And in that cleverness, we have managed to bring together so many incredible different disciplines, but health has sort of been stuck on the outside of it, and we need to integrate that. We need to find ways that we can get meteorologists talking to health researchers and vice versa. So I think foremost, it is about where we put our resources, but it's also about how we talk to people and how we share that data. And a lot of it's about just not being snobby about our research. It's my boss, Alan Dangle, our director of climate health, likes to say, I'm not here to fund people to be published in Nature and Science, the glamour mags of science. I want to fund research that's going to be used by policymakers. And I don't necessarily want them to be talked about in the high-fluting places that we're used to welcome research being talked about. I want it to be used by people who are affected by the crisis to help them solve those problems.
And turning to you, Ashley. So I recently followed you on Instagram, and there's these great videos of you on a school tour, engaging with school children on climate and health, and you're like exercising with them out in a like a schoolyard. I'm wondering, your focus is on youth. I'm wondering if you could talk a little bit about kind of what strategies have you found most effective in kind of engaging the youth on climate and health?
Yeah, thank you. And I guess those strategies will come based upon like my work at the grassroots level. When I first started my activism, it was mostly centered on non-communicable diseases. And from there, I realized that the health of our people is also interconnected to the health of our environment. So that led me to establish the Eco-Active Youth Project, in which you're seeing, which essentially focuses on children, in particular between the ages of 4 and 11 years old, in my home Barbados, to educate them about their role in taking action for the environment, but how they can create a healthy lifestyle. Because often when I go into the schools, I often say you cannot have a healthy lifestyle without having a healthy environment. So some of these strategies in which can be implemented, and young persons are often saying we need to be meaningfully included in decision-making spaces as it relates to climate and health. And as you also mentioned, the health crisis isn't really being spoken on at COP27 as well, and it linked to health. But recently back home in Barbados as well, through the foundation, we did a youth consultation, which is one of the strategies that stakeholders can use to really make young persons feel that they're meaningfully included in the decision-making spaces. And during that youth consultation, approximately 92 of the participants indicated that far more attention needs to be brought at a national level on youth engagement on environmental issues. But going back to the context and youth and other strategies that can be implemented as well, is I also founded the HEY campaign, which stands for Healthy and Environmentally Friendly Youth. And capacity building is an important strategy when it comes to activism and educating our young persons. And working in this space, lots of young persons really look at or require that level of training to further our advocacies on topics in which we're passionate about. And that was one of the main reasons why I developed the HEY campaign, which stands for Healthy and Environmentally Friendly Youth, to educate our young persons about the link that climate change is having on their physical health, but also their mental health as well. And another strategy more for stakeholders to engage in is that of supporting young persons' projects and initiatives. There are many innovative ideas on climate and health, climate entrepreneurship, so many different topics that we're seeing young persons implemented at a grassroots level within their community. And through the Say Hand campaign, we looked at reimagining and redefining climate finance in an intergenerational context. And we tested this pilot strategy, I would say, and we got over 1,400 applications from young persons globally. And the level of innovation behind the projects of young persons between the ages of 13 and 27 really was amazing, because as I said, it was a pilot, but what we're seeing within the level of strategies that need to be implemented is that there needs to be far greater level of support on youth engagement. One, I thank you for having me here as one of the youth on the panel, and that of capacity building in order to further our advocacies at a grassroots level. Thank you.
Thank you so much. Now, Diana, at Healthcare Without Harm, one of the things you guys are looking into is the impact of the carbon impact from the health sector. Can you talk a little bit more about this?
Of course, thank you, Sarah, and Thank you for inviting us to participate in this panel. So I would say, there we go. I would say about 10 years ago is when we really started looking at the carbon footprint of the healthcare sector. And we did this also in collaboration with the microphone does not like me. Sorry, everyone. And we started doing this because we do work very closely with health systems globally. And we were looking at mercury and other toxics, and we realized that our footprint as a healthcare sector is probably major. And what we found out since then is that, and this is something that most people don't know, is that the health sector accounts for about 5% of the global greenhouse gas emissions. And if you were a country, it would be the 5th largest emitter in the world. Now, obviously, some countries are worse than others. In the development context, we may have some health systems that don't have a very high greenhouse emission, but regardless, they need to be looking at how much they're going to be expanding the sector for universal healthcare in the next few years. And that requires also thinking about how they'll do that in an environmentally sustainable way. As we were looking at these footprints, we do realize, right, that healthcare sector is the sector that heals. And when we are thinking about how we as a sector are part of the problem, and are part of the system of climate change that actually reduces health, well-being and health, then that's a problem. And it is important then for us to really understand where these emissions are coming from. Are they coming from the direct sources of greenhouse gases, like transportation in terms of ambulances or cooling? Or is it coming from indirect sources, like our supply chain? How is it that the choices that we made about the medicines and the medical devices that we use are affecting the healthcare of the communities we actually serve? And we've been working with a huge network of hospitals and health systems around the world. We have about 1,600 health systems that are members of our network of green and global healthy hospitals, and they basically means about 65,000 hospitals and healthcare facilities around 80 countries that participate in this network, with whom we have a connection around developing tools and resources and guidance. And we work not only from that grassroots up, but also with WHO and the United Nations Development Program in working from the top down and making sure that it doesn't only happen from the institutions, but also from the policy level. And that's really important for us to continue to work on and making sure that we measure substantially the carbon footprint of the health sector. And I think that it's now even the Lancet Countdown is calculating these emissions, and they're trying to do this annually.
And Dr. Diarmid, could you talk a bit about kind of how the World Health Organization is evolving as an institution to adapt to the adapting climate?
Yeah, sure. At WHO, obviously, we have a massive agenda, and everybody's probably seen too much of WHO over the last 3 years, given what's been going on in the world. But in order to make it as simple as possible, we basically boil it down to 3 things. So we're trying to prevent disasters and emergencies and respond to them, including pandemics. That's one of the items. That's the one you'll have seen too much of. The second is universal health coverage. So we want to support countries to ensure everybody has the access to the health services they need. You can imagine that's also a massive agenda. And then the third thing that we do is to promote and protect health, to try and stop people getting sick in the first place. That's been in place for a while. Now, the third of those has been, I would say, the neglected child of this. And it's even more neglected in most national governments and ministries of health. So most ministries of health will spend a maximum of 3% of their budget on prevention and promotion. The rest of it goes to the urgent needs. So we're slightly better than that, not much better than that. But Dr. Tedros in his new mandate, he's just taken office for a second term, the big political signal he said was we want to reverse that. We want to make prevention and promotion the number one out of those 3 priorities. The one thing he called out was the climate crisis, said the overarching thing is the climate crisis. So that political signal, we will consistently say it, and we'll build it into our programming. We need to be more serious about it ourselves in following up on that, because that's not how it comes out yet in our budget, for example. But the signal is there, and that's absolutely true, because to be honest, we're overstretched. National Ministries of Health are overstretched with trying to provide the resources and the services to deal with the problems that were not dealt with in other sectors, and our own sectors in terms of emitting greenhouse gases, environmental pollution, air pollution, and so on. So the most successful health facility is one that doesn't have any patients because you've done too good a job in prevention in the community. So that's the very big picture. And then in terms specifically on the climate change work, again, we can boil it down to three things that we do. The first is to do everything we can to build climate resilience into all of the health programs that we have. And so we've been doing that actively, including we have the largest program in low and middle income countries on doing that in very practical ways in terms of early warning systems for heat, in terms of making water and sanitation systems more resilient to climate risks and so on. So that's one of the items. The second, and it's one that we're picking up on more, including in partnership with Healthcare Without Harm and others, is on ensuring that health systems are both more resilient but also more environmentally sustainable as well, for all of the reasons that Dana has just outlined, because healthcare is 10% of the global economy. It's a massive part of the global economy. Its emissions are actually growing, and we're also missing opportunities to provide better services, cheaper, and in a more environmentally sustainable way. And the third item, just to make the connection, is trying to ensure that all of the things that we do to drive down greenhouse gas emissions, because we have to, including for health for all of the reasons that you've heard, if we do those right, they bring massive health benefits. In fact, the benefits from air quality alone, the value of those is twice as big as what it costs to implement the Paris Agreement. So we think the health argument is actually a really positive argument for action on this. And the last thing I'd like to leave you with is we want to make this as practical as possible. And so to give you one example, we can talk in general terms about frameworks and so on. One of the things that we love is any healthcare facility that has a solar panel on it and has enough solar energy in order to protect, to provide the basic services, because it's cheaper. Solar energy is now the cheapest energy on the planet. It's more resilient when you get hit by climate risks. And by the way, it also reduces greenhouse gas emissions, but that's almost an afterthought. And so we want to get very practical, and we are getting very practical now in terms of working with partners. We're a technical agency. We're not the biggest funder in the world, but working with the World Bank and others to do these no-brainers, which is that we would say pretty much every healthcare facility in the world, low income, high income, and so on, should be looking at renewable energy for their energy provision. And we can give you examples of that across the board, but that's one that most people can picture.
Alice, what would you say is kind of how can partnerships in the health space be forged and strengthened to focus on climate change?
Well, I think it's vital that those of us who work in health organisations who are interested in climate talk to each other, like we're talking today, and we've got this WHO pavilion in the Blue Zone, which has been a real meeting point for a lot of people thinking about health. But and I was talking to some people the other day, but they were like, "Oh, I used to go to COP 15 years ago, and the healthcare people, you could sit around one table, and now there's like 4 tables of us." And you're like, "Great, we're building," but we can't just. There's power in us connecting and sharing. Ideas, tactics, relationships, boosting each other, talking about each other to other people. There will be some things where we take a strategic approach together, where we think, right, what is our core messages that we want to keep repeating, but also accepting that there is quite a lot of ideological diversity, cultural diversity, political diversity within that, and not saying, right, if we're health people, we have to believe in this, because actually, a healthy system will include a diversity of thought, and saying, well, we're going to cooperate on this, let each other know about that, but we're going to have our own tactics and our own approaches. But we can't just stay in that bubble, because climate, we all know this from those of us who've worked in climate, know the climate field is very, very complicated. It's got lots of aspects to it. And it's very easy when a new issue grows to go, right, I'm going to connect with other people on this issue. And then you just end up building your own bubble. So there's a danger with the health capacity area where we work together really well and we don't talk to other people. So it's vital that as we build partnerships with each other, we're also going out and making lots of partnerships elsewhere. Because there's been a lot of talk about how much more people are talking about health in the climate spaces. I think we really saw it with the releases of the IPCC reports this year. Health was talked about so much more than it has previously. We have events like this, we have the WHO Pavilion at Blue Zone, etc. But it's not, it's not still, it's actually, it's not just in those places where we say health, where there's a little, someone wearing a white coat and a stethoscope, or a little label saying WHO or something, or one of the logos of Wellcome or WHO or whatever. It's also actually, it's across COP. It's across climate. Health is everywhere. And I think we need to bring that out in those places, adaptation, in gender, in youth, in all those other spaces that come with other labels and other logos. And as we build, because the climate crisis is a health crisis, it can't stay in its own bubble. And that's what we need to think about for partnerships going forward. Yes, we need to work together and build our community, but we also need to be out doing so much outreach.
We're almost out of time, but Deanna, so part of your work focuses on policy guidance. I'm wondering if you could give us kind of your top policy recommendations on how health systems globally and domestically can adapt to climate change.
Sure, thank you, Sarah. No, where to start? So let's start. You're kidding me. It was Diarmid he just wants to give me his microphone. So just to start, let's start with the title of the Devex conference here, right? From commitment to action. Let's start with the commitments first. WHO has this wonderful platform that's called the Attach Platform, the Alliance for Transformative Action in Climate and Health. And if the country has not committed yet to the COP26 health program and set up this commitment to low and resilient health systems, then they should do that now. If you have committed, we have set up these working groups that we want to be kind of this learning platform between countries, civil society, private sector, to know kind of what are the main things that are driving us, the tools, the guidance, and how we're making progress, and how we can help each other, really. And so it's a wonderful platform, and that I certainly think countries should try to join. Also, WHO, hats off. They have wonderful guidance on resilience in adaptation plans for and health national adaptation plans, right? And they start really with an assessment of vulnerability. And those should be central to countries who are looking to adapt their health systems. Finally, just, we're all learning together. This is a really a space that's new, but that we need to move forward, and we need to speak to each other, just like Alice said. Don't stay in your silo. If you are a health practitioner, or if you are operating in countries where you are having a seat on the table, make sure that seat at the table also is not just in the health space, but you get yourself introduced in the climate negotiations, in the climate talks within your country and in the global level.
Okay.
Thank you.
Thank you. And a last word from Ashley. How do we change the narrative to convince people that the climate crisis is a health emergency?
Well, I think for me, how do we do that is based upon telling a story. I have often been told that people resonate very well with the story. And I remember through the Hey campaign, one of our Hey ambassadors, she was from the island of Dominica, and she was telling us that after Hurricane Maria devastated her country, it had a toll on her family and her mental health as a result. So we've realized that utilizing social media to tell the story that climate change is a health emergency. And we saw a lot of that in Pakistan when it was devastated by the floods. We saw that thousands of persons were being affected by waterborne diseases as a result, and those stories were being told on social media. So as more and more persons can contribute to the storytelling of how the climate change has an impact on their health or their community's health, then I believe that more persons will acknowledge the fact that climate change is a health emergency, but the truth of the matter is that although we know that climate change is a health crisis, persons aren't willing to act unless it is impacting them directly. And that's why the narrative of storytelling on these issues needs to be heightened, and a greater level of sensitization and awareness needs to be brought to the fore. Thank you.
Thank you. I love that. The power of storytelling. Thank you all so much for joining.
Thank you.
Thank you.